What is an NT scan? Well, NT means nuchal thickness or nasal bones. So this is a special ultrasound which is done between 11 weeks to 13 plus 6 weeks. So these are just numbers that societies world over came up with, and so that they can standardize everything. Okay, so nuchal thickness is basically the neck thickness of the baby. It's measured by special people, like special radiologists or normal gynecologists shouldn't be doing it unless they are like certified to do it. So it's done by radiologists or fetal-maternal experts, and it is done in special machines. So those people will be doing it. So your doctor will send you for this ultrasound to different people, or unless she's certified, she will do it. What does that mean, doing this test? Because this test, if the neck thickness is more, it is sort of a marker of having some problems. Maybe your baby might have some problems in future. So it can look like Down syndrome or Turner syndrome, some neural defects and all of that. So this 11 to 14 week scan, 11 to 13 plus 6 week scan is a very important scan, because first of all, it gives you an accurate date for delivery, and also it will rule out so many small defects in the baby. Like there are certain problems like the baby has no head, or there is a cardiac defect, and then you can undergo termination, legal termination. If that is the case, you don't have to wait for it to happen throughout the pregnancy and then deliver a problem baby. So that's nuchal thickness. It's offered to all patients everywhere, not just elderly, not just women who are more than 35, not just women who are who are having type 2 diabetes or some medical disorders, offered for everyone. So that's nuchal translucency scan, and you need to do it between 11 to 14 weeks. Now, what if you don't do it? If you don't do it, that's fine too, because most babies are fine, and everything that we tell you to do in pregnancy, that does not mean you have to do it. You always have a choice to say no. And just because you're pregnant and out of fear, you don't need to do 1000 tests along with it, because the more tests you do, the more anxious you will get, and it doesn't produce any fruitful result. You are either going to have a baby or you're not going to have a baby. That's it, right? So along with nuchal translucency, some doctors will offer other tests like a double marker, which is another blood test which will go with the nuchal translucency, and it will calculate the risk that you have to have Down syndrome or trisomies, Edwards or Patau's. So these are the 3 genetic defects that we screen for in women, because they are sort of not compatible with life, which is also controversial, because some Down syndrome babies are compatible with life, so we don't terminate them. But in India, if you find these three things, then probably you will, if you have these problems, you have an option for termination at an earlier gestational age. If these tests come abnormal, you might need a future test, a confirmatory test, because it's a screening test. It does not tell you definite answer that you have a problem baby. If there is a problem in this, you need a confirmatory test, which is basically a karyotype, wherein you take the DNA of the baby in the form of amniocentesis, that is a fluid around the baby, or Coriolis biopsy, wherein you take a tissue of the placenta of the baby. And then they will look at the DNA of the baby. If there is a problem in the DNA, specific diseases, then they will offer termination.